Now, Congolese officials and the World Health Organization are vaccinating health workers against the deadly Ebola virus to try to halt an outbreak in Congo's volatile eastern region. Health workers have administered the vaccine in the eastern DRC village of Mangina, where the epidemic was declared. The health ministry says so far 43 people are believed to have been infected in the North Kivu and Ituri provinces, including 36 who have died. More than 45 have contacted the contact of those, more than 900 rather, contacts of those infected have been identified for monitoring. The experimental Ebola vaccine being used is manufactured by Merck and proved successful during its first wide-scale usage against the previous outbreak in Equateur province. The World Health Organization says analysis of genetic sequencing showed it was a separate outbreak from the one that ended less than 2 weeks ago after killing 33 people.
It's true that you want us to carry out mass vaccinations of the whole population, but the scientific recommendations are that this is not the way we will stop the epidemic. So if we want to stop the epidemic, we must respect the rules and the codes that have been established. The codes in place are we must respect the pillars, hygiene, dignified burial, and vaccination. And when we start vaccinations, to go from circle to circle.
First of all, we ask the population not to panic. That's the worst thing to do. When people do not panic, they are able to follow recommendations more effectively. In addition, we ask people to wash their hands as often as possible with soap. Chlorine is even better to wash their hands, but if they do not have access to chlorine, they should use soap. We ask for more hand-washing stations. Furthermore, people should stop shaking their hands. Following these 3 guidelines can help with prevention. On the other hand, we ask that if a family member has a fever, bring them to the hospital to be properly diagnosed. People should avoid home diagnosis. The reality is Ebola is here and must be stopped.
Health officials say a total of over 3,200 doses of the RVSV-Zibov Ebola vaccine are currently available in the country. Supplementary doses have not yet been requested.